You know that ache in your back or that little twinge in your shoulder? Yeah, most of us just kind of brush it off. It's just part of life, right? But what if that simple, everyday pain is actually a misleading clue, a distress signal from a part of your body you'd never, ever suspect? Okay, let's get into this medical mystery.
This sentence right here, it tells a whole tragic story. It's all about a connection that was completely missed. A puzzle where all the pieces were sitting right there on the table, but no one saw how they fit together. At least, not until it was way too late.
So, the story starts with something incredibly common, something pretty much all of us have felt at some point. A sore back. You bend the wrong way, you lift something a little too heavy, and the cause seems totally obvious. But here's the twist. In this case, the obvious answer, it was tragically, completely wrong. The real problem wasn't in his back at all. It was hiding in plain sight.
All right, let's really unpack the case that sparked this whole explainer. It all starts with a 66-year-old university professor who did something totally ordinary. He twisted his back, taking out the garbage.
So he goes to a physical therapist with his nagging, painful lower back. The diagnosis? A simple muscle strain. Now, he did mention he'd had some digestive issues in the past, but they were off and on, and they never happened at the same time as his back pain. So, nobody made a connection.
It wasn't until he collapsed at work and was hospitalized that the hidden cause was finally dragged into the light. It wasn't a muscle strain. It was advanced colon cancer. And this case just powerfully shows you how high the stakes are when we get it wrong.
So this brings us to the central question, right? It sounds baffling. How on earth can a disease deep inside your gut disguise itself as a simple backache? Well, the answer is all tangled up in our body's complex wiring.
To get our heads around this, we've got to talk about this fascinating phenomenon where our brain basically gets its signals crossed, creating a kind of biological illusion.
It's called referred pain, and it happens because the nerves from our internal organs, like our intestines, and the nerves from our skin and muscles all plug into the same junction box in our spinal cord. Our brain is way more used to getting pain signals from our skin and muscles, so when a signal comes in from an organ on that shared pathway, the brain gets confused and shouts, "Hey, the back hurts." And look, this is a perfect visual of that exact confusion. Nerves from the small intestine are sharing a pathway with nerves from the lower back. So when the intestine is sending out an SOS, the brain might sound the alarm for the lower back, even if the back muscles themselves are totally fine. And here's the key. It's about the type of pain. Think about it. If you get a paper cut, that's skin pain. It's sharp, it's intense, and you know exactly where it is. But pain from your organs, what we call visceral pain, it's different. It's vague, it's deep, it's this kind of gnawing ache that you can't quite put your finger on, and that's what makes it so easy to misinterpret.
And this isn't just about back pain. Oh no. The body has a whole bag of these deceptive tricks. Let's jump to another case file and see how this pattern builds.
Okay, check this out. A young, super athletic soccer player takes a hard hit to his side. It knocks the wind out of him, but he shakes it off, finishes the game. But the next day, his left shoulder is in agony. Turns out, the source of the pain wasn't his shoulder at all. It was a ruptured spleen, which was bleeding into his abdomen.
And you know what's so wild here? The very things that made him an elite athlete, his excellent physical condition and high pain tolerance, actually worked against him. They masked just how severe this life-threatening injury was, which was sending a referred pain signal all the way up to his shoulder. So it's not just about sudden injuries. There are other, sneakier red flags to watch out for, and one of the most serious is gastrointestinal bleeding. And just like with the professor, it can show up as, you guessed it, nothing more than a stubborn pain right in the middle of your back.
All right, this is super important. This is a list of signs you should never, ever ignore. If you see vomit that looks like coffee grounds, that can mean bleeding high up in your GI tract. Dark, tarry stools, that's called melena. That means a significant amount of blood. The key here isn't to diagnose, but just to be aware of these changes and tell your doctor.
So what else should we be listening for? Our bodies often give us a whole constellation of symptoms, and learning how to spot the patterns, well, that's the key.
Just look at this list for a second. Joint pain, difficulty swallowing, feeling full after just a few bites of food. These don't exactly scream gastrointestinal problem, do they? But they can be absolutely crucial clues. For example, inflammation deep in the gut can trigger an immune response throughout your whole body that leads to painful joints.
And sometimes the connection is, well, it's literally physical. This is the psoas muscle. It's a deep core muscle that connects your spine to your leg. Now look how it's just nestled right up against the intestines and other organs. There's really no protective barrier there.
So an infection from something like Crohn's disease can actually spread right to that muscle, causing pain in your back, hip, or pelvis.
Okay, so we've got all this information, but the most important thing is knowing what to do with it. And that brings us to how you can be a better advocate for your own health.
Now, I want to be 100% crystal clear here. The point of this is not for you to go self-diagnose on the internet. Absolutely not. It's to empower you to give your doctor the complete story, to give them all the puzzle pieces, even the ones that don't seem to fit.
Think about it. When you go to the doctor for back pain, their focus is naturally going to be on your back. It's up to you to mention the other stuff. Have you noticed any changes in your bowel habits? Any other weird aches or pains? Feeling tired all the time? Unexplained weight loss? Just mentioning these seemingly unrelated details can totally change the direction of an investigation. And this brings us to our final, and maybe the most important takeaway. This quote from the analysis of the professor's case is such a simple, powerful tool for both patients and doctors. Always ask, are you having any other symptoms of any kind anywhere else in your body? It's just a reminder that sometimes the one clue that solves the entire mystery is hiding where no one even thought to look. So, what silent signals might your body be sending you?